Hello everyone. Today I'll be talking about types of angiographies and angioplasties. I am Dr. Amit Bhushan Sharma, Director Cardiology and Unit Head Paras Group of Hospitals Gurgaon. Angiographies, there are three types of angiographies: a CT coronary angiography, a mini angiography which is done through the wrist, and a major angiography which is done through the groin. What indication is for which type of patient? CT coronary angiography is meant for a younger individual, 15 years age, 20 years age, who has like a muscular pain, atypical pain, and you know for a fact it is not cardiac. Then you do a CT coronary angiography. In case if you have any suspicion, let us say if there is a 50 years old gentleman who is diabetic and who is complaining of shortness of breath, or complaining of sweating, or complaining of weakness, so those cases CT coronary angiography will create more confusion rather than convincing us, because CT coronary angiography has got a wide standard of variation. That means 30% blockage can be 70% and vice versa. But CT angiography has got a good negative predictive value. That means if it is totally normal, it gives you a guarantee for the next 10 years there is no problem. So it is a good test for somebody who's a young individual. For older individuals with risk factors, you get more confused rather than convinced, and then we end up doing a mini angiography. How we do a mini angiography, I will show you in the next video. So if you see very carefully, there is a small needle which goes through the hand, and it goes all the way from the hand to the elbow to the shoulder, and then it goes into the heart, and in the heart we take images of the blood vessels, and if the blockage is less than 70%, the plan is only medical management. If the blockage is more than 70%, the process of angiography gets converted to angioplasty, where you are seeing very clearly that there was a blockage, and then the balloon which is going here, and the balloon which is going here now, after the balloon is getting dilated, lumen is getting increased, size बढ़ रहा है. So when the lumen is getting increased, after that this is followed by a process of stenting, the stent which is opened up here, and once the stent is opened up, the blood flow is restored and the heart function starts briskly. Many times the third type of angiography, which is called as a major angiography, which is done from the groin or from the leg blood vessels, it is done from the leg vessels. Very rarely do we do this type of angioplasty these days. Nowadays 95% of the work is from the hand, 5% of the work is from the legs. In cases where the hand is fractured or when the hand vessel is very narrow, then we do the same thing through the leg. Major angiography or minor angiography, both information is the same. Advantage of a minor angiography is, or a mini angiography is, the patient can go home the same day, he can stand up and he can walk, everything is done from the wrist. The learning curve for the cardiologist is a little more, but it is very beneficial for the patient. So whenever you are asking for it, you ask for a mini angiography, especially in elderly age group or people with any risk factor.